side going in?
Yep, you're on this side, and I'm going this way.
Just give me a quick heads up so I can let them know.
I will stand here, and Brian will be here, you will be here, or Jeff will be there, and then you will go, and I will slide back up. Brian will slide over, then we'll say no questions. Have a good day. Couple more minutes. Time. Jeff, you should switch with Brian. All right, let's go. Good afternoon. My name is Larry Johnson, and I'm the County Health Director for Shiawassee County. With me today are Brian Long, CEO of Memorial Healthcare, Jeff Weiss, County Emergency Manager, and Commissioner Jeremy Root, Chairman of the Board. We are gathered here today to provide an update on efforts being undertaken at the county level in response to this historic coronavirus outbreak, COVID-19. We are facing an unprecedented situation, and it requires an unprecedented response. As of today, right now, there are 53 confirmed cases of COVID-19 in the state of Michigan. There are 0 confirmed cases in Shiawassee County. However, we are operating under the premise that the virus is already here. The health department has been working closely with federal, state, and local partners. We have been consulting with Memorial Healthcare, emergency management, the courts, sheriff's department, our business community, schools, and numerous other partners. Today, Governor Gretchen Whitmer issued an executive order closing restaurants, bars, and numerous other facilities effective at 3 p.m. through March 30th. This follows other executive orders issued by the governor closing schools, restricting crowds to 250 or less, and this is all part of a worldwide effort to slow the spread of this virus. Everything we are doing is for the protection of public health. The core premise that we are operating under revolves around social distancing and community separation. Following these directives, along with practicing proper hygiene, such as hand washing, sneezing into your arm, staying home when you're sick, and avoiding touching your face, will allow us to slow the spread and eventually beat this disease. The health department has established a phone number for local residents to call with questions regarding COVID-19. That number is 989 area code 743-2460. We want residents to prepare, but not to panic. I'm proud of our citizens and the sacrifices they are making. Americans are resilient, and we will be victorious. Thank you. Now I'm going to turn it over to Brian Long, CEO of Memorial Healthcare.
Thank you, Larry. Good afternoon. My name is Brian Long, the President and CEO at Memorial Healthcare. At Memorial Healthcare, our greatest responsibility is the health and safety of our patients, staff, and community. With the ongoing COVID-19 epidemic, we recognize the growing uncertainty and anxiety that the community has. That's why we are committed to keeping you informed and better prepared. We have implemented operational and procedural updates to limit potential exposures to the virus and to prepare for management and treatment of any potential and/or confirmed cases in our community. Memorial Healthcare has established an alternative care site for those individuals experiencing mild to moderate flu-like symptoms such as fever or cough. This location is operational 24/7. The alternative care site is located on the main campus of Memorial Healthcare at the South Auditorium entrance facing the King Street entrance. If you are experiencing severe symptoms such as extreme shortness of breath, we ask that you call 911 or proceed directly to the local emergency department. We are working closely with Shiawassee County Health Department, closely following updates and guidance from the Centers for Disease Control, as well as the World Health Organization and state organizations, including the Michigan Department of Health and Human Services. Also, under the executive order from the Governor of the state of Michigan, Memorial Healthcare is closed to all visitors until April 5th. We understand that this is a challenging and stressful time. As your healthcare provider, we remain committed to providing you with the highest quality care as we continue to process and implement additional measures of prevention and containment for COVID-19. We ask that you continue to follow our website and social media channels to stay up to date on any new developments. Thank you.
Good afternoon. I am Jeff Weiss from Shiawassee County Emergency Management. Our Emergency Operations Center for Shiawassee County has been activated. We have staff on site. Our role in this pandemic is to process information that comes through the Emergency Operations Center. We take in resource requests from the citizens of Shiawassee County, process those, and get people what they need. As Mr. Johnson stated, the health department is the lead in Shiawassee County for this pandemic. We are taking our cues from them. We have been in constant contact with our partners at the Michigan State Police Emergency Management Homeland Security Division, and we are getting constant updates, sometimes many an hour, from the State Police Emergency Management Homeland Security Division on where we go from here. It's important to note, in March of last year, this community suffered a catastrophic tornado. That was almost a year to date. At that time, the community came together and they helped their neighbors, they helped their friends. This is what we're asking today. We're asking that you look out for your neighbors, you look out for your friends, you look out for the elderly population. We will, as Mr. Johnson said, will continue to feed information to the public, and we will make it through this pandemic. Thank you.
All right, thank you. Thank you everyone for attending. I am Jeremy Root, the chairman of the Shiawassee County Board of Commissioners. And I just want to start by addressing sort of what we're doing at the county end to handle this. We are actively monitoring this situation with our health director and an emergency manager on a daily basis. We're having briefings daily to determine the status, because this is a rapidly changing event that continues to change hourly. So we are monitoring that. I've spoke to our neighboring communities, our other board chairs in other counties, and they are actively monitoring in a similar fashion. Operations have stayed open in other counties. We have continued to do that as well. But we are preparing, and we have instructed our county staff to be prepared for the potential of a full closure, with the idea that essential services like our courts, our law enforcement, 911, and our health director's office will stay open. At that point, for us this week, this is our Board of Commissioners week, we have decided to cancel all committee meetings. We've consolidated our meetings into one for tomorrow at 10 a.m. We will only be handling necessary fiduciary responsibilities for the board, contractual arrangements, and our payroll bills, obligations as such. We have immediately, as an effort to our staff and the people that are continuing to come to work every day with the uncertainty, we have immediately stepped up our efforts on cleaning by hiring new staff to bring in to make sure that offices are being cleaned on a more regular basis, and so that staff doesn't have to be the only ones cleaning their office. So that's one of our commitments to our staff, to make them feel more comfortable and try to limit their exposure to this outbreak as much as possible. We also as a board appreciate the patience of our county staff and the understanding of our county staff as we navigate through this, and trusting in our leadership at this time. And I do want to say that to all of our residents, you know, the county is using the full effort and the full resources that we have to tackle this outbreak, to manage it, and to get through it. And I'll leave with what we're trying to do across the county is let people know, do not panic, but be prepared. You know, be prepared at all costs. And then we want to continue to emphasize social distancing and our community separation. That's why for our board meeting tomorrow, we are encouraging the public does not attend. We will be live streaming. We encourage you to watch the video, everyone. But we definitely encourage that the public not come out due to the outbreak. And I'll end with that. And I'll bring up the Director of the Health Department again, with Larry Johnson.
Thank you. At this time, we will take a few brief questions on COVID-19 topics. With us also today are Dr. Dennis Chernin, our County Medical Director, Sheriff Brian Bagol, our County Sheriff, and Prosecuting Attorney Scott Kerner, in case we have any legal questions. So with that, I will open it up to questions.
You mentioned there's an alternative site. Are there any people at it right now? Are there any infected cases in the county?
I'll defer to Brian Long.
The question was related to the alternative care site. It is operational. This is the second, actually, of 2 locations. This site went operational first thing Saturday morning, 7 a.m. When I last left the campus, we did have about 15 to 20 individuals being processed through that site. So yes, it is operational. We do have activity there currently, and both testing, triaging, as well as treatment of individuals is taking place currently.
Okay, so have those 15 people been tested?
So at the alternative care site, the testing for COVID-19 is not the initial interaction. So it's intended to provide an access to the community as well as our own healthcare providers to provide an alternative site for the assessment and the appropriate testing for COVID-19. What we're finding in that site is about 40 to 50% of individuals presenting have been tested for items other than COVID-19 successfully. So we've seen a lot of influenza B, RSV, strep, influenza B, I said that B and A. And so those individuals are being treated in the typical fashion. But we are keeping those individuals out of urgent cares, primary care, and emergency department. If individuals are symptomatic and respond negatively to those tests, then they go on in the algorithm to be tested for COVID-19. As of today's date, we have about 50 individuals that have been tested, but no confirmations of any positive cases have yet been returned.
I've been asked this question several times, but are there enough test kits available?
The short answer is no. Right now, one of the biggest challenges related to test kits is the availability. I said there's about 50 cases that have been tested. We're still holding some of those for median to be able to transport and test. So test kits are one of the weak links right now. From my understanding in communications this afternoon, the state does not have the capacity beyond about 115 tests on a daily basis. That's inadequate for the level of testing that we need. Those resources are building now. We have outside independent labs that we're working with in testing. Memorial is also bringing in-house capability to play where we'll be able to greatly increase the testing on site, but it's not operational yet, and it will not likely be operational for under a 2-week period. Once that operational status has been achieved, we should be able to process approximately 96 cases every 2.5 to 4 hours. So much larger volume and much faster turnaround.
Will that be the only place in the county to get tested?
It is not the only place to be tested. As far as the testing itself, again, I want to remind you, testing is not being currently performed at Memorial. We are simply a facilitator of the protocols that provides that testing. We cannot process the test either at independent labs currently or through the state without meeting that earlier protocol that I described. So once that's been done, then the testing goes outside. But right now, that's being done, as far as I know, without exception at Memorial.
Question regarding, probably to Larry, please. Regarding the fallback on what's happening in our social services. Many children, they were getting their meals at school. Many children are not getting their meals anymore, and now they're spending their time with the elderly, with their grandparents, whether their parents work. Is there possibly going to be some negative fallout where people are actually going to be more hurt and maybe sick and die of other things because of this shutdown?
Thanks, Tom, for that question. To address the food for the students, we were working really closely with the school districts, all of the superintendents, and the RESD. And I can tell you that the RESD has a plan in place to feed the kids. With regard to having to be babysat at grandparents or so on and so forth, we are in uncharted territory. So for me to tell you that someone's not going to be made ill because their grandkids are with them, I just couldn't do that. So we need to all bind together and do the best we can to get through this.
One other question, I'm hearing that some places are you're not planning on closing at 3 o'clock.
Okay.
What's you know, we're
So,
doing that.
so the governor has issued that order. That is an enforceable order, and we will work through our county prosecutor and our local sheriff and the state attorney general's office to ensure compliance.
Thank you.
Any other questions for any of us? Okay. All right. Well, I'd like to thank everyone for coming, and I appreciate the media being here today to take note of this and get the message out to our residents. Thank you very much.